good. I see everything right now.
Yeah. All right. Welcome to the show, folks. This is the daily COVID-19 broadcast with Dr. Derry and Doc Griggs.
Dr. Derry, are we on Facebook?
We are live for today, May 27th.
Yeah.
We have a jam-packed show for you. Please don't forget to subscribe to our daily podcast that we have every day called NoiseFilter. You can find more information about it at NoiseFilterShow.com. Dr. Griggs?
Yes, you can find us on NoiseFilterShow.com. I'm trying to create a watch party. There's a lot going on. There's a lot of things going on in the world right now, Doc, outside of our COVID stuff. But I want to make sure that everyone gets things in their proper context. In spite of the fact that we are reopening, in spite of the fact that we are in the midst of a global pandemic, nothing has changed about the virus, but hopefully something will change about us and we will evolve and be better on the other side of this. There's some things that have happened. There's some media stories that are out that are COVID related and some non-COVID related that directly attack and address health disparities and racial disparities. And we just want to be better. I do community medicine and health literacy, meaning I am 100% community, 100% medicine, 100% health literacy. We need to have a dialogue, take the elephants out of the room, and have candid conversations so we can survive, because this COVID-19 thing isn't going anywhere. The virus has not changed. We have no vaccine, we have no cure, but what we do have, we have Dr. Derry and stats. Dun, dun, dun. He didn't expect that. Dr. Derry, take it away.
Are you trying to change the focus? Did you not like all the little captions I was showing?
What captions?
Yeah, that's what I thought. So did you want to talk about some of that stuff, or?
Yeah, I did at some point. It's totally you. I know people are used to our slides and they look forward to them, but I want to make sure that things are in proper context. That things are in proper context, Doc, because we made note, we won't talk about where they came from, but there is some missing and potentially disinformation out there right now about the virus. And at this late stage in the game, we can't afford to deviate or pivot from our trajectory, because the trajectory of the virus might have plateaued. If we infuse mis and disinformation, it will start to skyrocket a lot sooner before we even think about a second wave. So again, take it away, Doc. Oh, wait, that way. There we go. Take it away, Doc.
Yeah, it's confusing, huh? Like it's all backwards.
That way.
Yeah, I was trying to do peace out. And I was like,
no, you got in trouble doing that yesterday.
All right. So let's start with our slides. You're gonna appreciate. I guess I'll wait for you to do your watch party, so I don't want to interrupt your watch partiness.
Don't wait or hate on my watch party. You do what you're supposed to do, and I'll do what I got.
All right. You're gonna appreciate this. Look what I got. Look at that first slide there, Doc Griggs.
Much better. Wow. Holy smokes, Batman. Who dat?
Do you like that?
Yeah, I like that.
I figured you would appreciate that slide better. Although I did like the other one, but
hey man, it's not easy being green.
It's easier to be black and white, I tell you that.
Yeah, there you go.
All right. So again, as a reminder, we do have a daily podcast that you can find our podcast on all the major podcast apps. It's called NoiseFilter. Doc Griggs and I talk. It's about a 10-minute podcast. It's high yield and really focusing on COVID-19 from the issues of health and equities. Be sure to use the chat function to talk with us, and we'd love to answer your questions. So please ask us COVID-19 related questions. With that, let's get started with the numbers. We're at 5.
We like you too. We like it when you like us, but we love it when you share this broadcast. Please share. Doc, sorry about that. Share.
No, that's okay. So yes, please share this stream. And again, we love to hear from folks. We have some questions that are starting to come in, and we will get to those questions as soon as we're done with the slides. But thank you so much for asking those questions, and hello to everybody who's writing in. I will get to those questions in just a moment. Dr. Griggs, are you gonna wave a little bit more? Did you have your watch party that you needed to do, or did Can I get
Oh,
started?
we're taking credit. I was actually being polite. It's a New Orleans thing to speak to people and say hello. You said hello, and I made sure I spoke.
It's just in New Orleans that people say hello?
Yeah. We say good morning, good evening, and good night. How about that?
In Montreal, Canada, they don't say hello?
I don't know if they do, but I know on the other side of the screen they don't say it. You didn't wave.
Because I'm a broadcast professional, that's why.
Yeah, that's exactly. Yeah, I love that you call yourself that. I got all night.
All right. Well, you know what? I have control here, so let me let me go back to share screen.
Mr. Professional.
Hang on, but I do have to do one thing though. I have to do that, and then I have to. You can help me with some of this stuff too if you see it not working out well. Okay. So as you guys can see, we are rapidly approaching 5.8 million cases worldwide. We know that number is a lot more. 355,000 deaths, which is incredibly, it's just hard to even consider it. New cases overnight were almost 69,000. That number is usually around 75,000, so it's a little down from what we call normal. We're going to start seeing a lot more cases happening in South America. Watch out for that. Number of cases are down from roughly, they're about 3,436 was the number of new deaths. That works out to about 2.5 people who are dying around the world per minute from COVID-19. Again, you are seeing cases. We are seeing global cases are definitely going up. And again, watch out for South America. We're going to start seeing a lot more cases that are going to be brewing in South America, as well as Africa, especially as more testing becomes available. There's some good news. This mortality trend line is continually moving in a downward direction. Of course, this is a very positive thing. You'll notice that yesterday we logged in the least amount of deaths, which is pretty nice almost since the pandemic began. But of course, things just kind of the following day, which is today, kind of went back up again. Unfortunately, this was very, I was very hopeful that something was going to be moving in the downward trajectory, and that's not necessarily the case right now. In terms of the U.S. cases, we're almost at, far exceeded 1.7 million, reaching 1.8 million. We far exceeded 100,000 deaths. We're, as you can see here, we added about 12,881 cases overnight, 957 deaths. It's one death every 2 minutes. U.S. now makes up 30% of all global cases and 33% of all global deaths. This is incredibly shameful. Again, watch out for Brazil. Brazil is going to start putting some serious numbers on the board here very soon. We're rapidly approaching World War I levels in terms of deaths. We've blown through a Korean War and Vietnam War in terms of the number of people lost, rapidly approaching World War I. You can see here in the U.S., cases do appear to be going down, so this is somewhat a positive thing. And of course, I hope that this continues to be the case, greatly so. I'll have you note also that the New York Times, again, is always a little behind Worldometer, even though they say this has been updated. You can see here the number of deaths. They haven't registered over 100,000 yet. You can see that this is great news. The mortality is definitely going down in the U.S. And again, I think this is largely related to the fact that we have better understanding of the disease process. Looking at the testing and looking at a country that's notable, Iceland, at 174,000, almost 175,000 tests per million population. The U.S. is ranked number 36 with 47,000 tests. When Dr. Griggs and I started this was about 3,000. So we've definitely made some positive movement forward. And the COVID tracking project has us totally at almost 15 million total tests that were done. When we look at the positivity rate, you can see it's about 11%. We want that number to be less than 5%. The positivity rate is taking the total positives, adding it to the total negatives, which is what you get here. And then you take that and you divide the total number of positives by the total number of positives and negatives. Looking at the state of Louisiana, we're about 38,504 cases with about 2,726 deaths. Of course, the majority of those deaths and cases are happening in Orleans and Jefferson Parish. Last night, we added about 436 cases and about 25 new deaths. And so we still have work to do. Cases in Louisiana look like this trend line may be going up. I don't know. It's kind of hard to say. Hopefully it's stable, and hopefully we're not going to be seeing new cases. Looking at mortality rate, this line is definitely going down. You could see yesterday the state posted its first day of no deaths, which is really incredible since the start of the pandemic. And so that's been great. I'm going to hold right here before we continue on and let Doc Griggs say a couple words if he has anything he wants to share with us with respect to any of the numbers that we've gone over.
Yeah, I just want to make note of the fact that we did see no deaths, and to not be too contented in that based on the behaviors that we experienced over the weekend, and to understand that the virus, I'll say it again until everyone gets tired of me saying it, the virus has not changed. Viruses don't spread viruses. People spread viruses. If we do not respect and practice social distancing and wearing our masks, some of the behaviors that we saw over the weekend will cause the numbers to go up, and we will, again, potentially see a spike and overrun our medical and healthcare system. So let's not get too comfortable. Let's enjoy the numbers, because apparently 2 weeks ago we were doing what we were supposed to do. Doc?
Yeah, absolutely. We will be talking about some of these openings that we've been seeing. And again, it was nice to have posted no deaths overnight. So that's certainly great news. And with that, let's finish off. Pardon?
Nothing. I'm just trying to get my picture back up, Doc. Keep going.
Okay, got it. All right, so let's finish off with where we were. And my phone is going crazy here. All right, so just to wrap up with our slide deck at this point, as you can see, like we were saying, it's really great to see Louisiana cases are dropping. When you look at the case rates, we are 1, 2, 3, 4, 5, 6, 7, 8, 9. So we're 9. So these are the total cases per million population. You can see that Louisiana is 9th, but I want you to take note that Illinois is going to start rising up. I predict that Illinois is going to be moving up that scale fairly quickly. So it's just something for you to look at. In terms of mortality rate, we're still 1, 2, 3, 4, 5, 6 with 586 deaths per million people. As compared to some of the other northeastern states as well. In terms of our testing, we used to be number 1, 2, and 3, but we're 1, 2, 3, 4, 5, 6. One of the newcomers here is North Dakota, and North Dakota has been doing an amazing job really focusing on their testing and their testing sites as well. So big kudos to North Dakota and their governor, who's been really focused on getting as many people tested as possible. This is looking at Louisiana specific, and what we see is the infection rate is 1.04. That's the R0, that's the reproductive number, that's the number by which this virus can spread. Anything over 1 means the virus can spread. So here you can see active cases are slowly increasing. So it's not good, because that graph looks like it's going down. Our positivity rate in the state of Louisiana is under 5%. This is very, very good. We have plenty of ICUs that are available, and our contact tracing can just certainly be a lot better. It's at 16%. Here you can see our R0 for Orleans. So I love that it says Orleans County. We got to get them to change that. It's actually Orleans Parish, as we know. But you can see here our infection rate is 0.89. And we have a 90% confidence interval, in which in the 90th percent confidence interval, it does spread into 1.22. So reproductive rate of 1.22. So we're not out of the woods yet. And so this only gives us up to May 24th. So we still need to get some more data from them. In terms of new cases, the states in blue and Orleans parishes in gold. Of course, we are seeing new cases. That should not be a surprise. In terms of new deaths, we saw that little dip here, but we've seen increasing new deaths and new tests. The state's been really great with making sure that that tests are available. And here, as you can see, ventilators in use are plenty. ICU beds are plenty, and hospital beds are plenty. Looking at Brazil, you can see Brazil is just continuing their upward trajectory in terms of cases, and you can see the same thing with mortality. It's just not getting anywhere near close to being done. And of course, we will talk about some of those reasons in just a moment. But let me, for some reason, we lost Doc Griggs. I'm not sure where Doc Griggs went. Keep talking, my computer just randomly restarted. All right, looks like Doc Griggs, his computer restarted. This is something that happens. So I guess what we'll do is we'll just continue on. And well, let me answer some questions here. There's definitely some questions coming in. So the first question is it true that once you've had COVID and that you're immune from getting it again? Because I'm hearing different stories. So Lexi, that's a great question. Let me answer that for you. So the issue with COVID and the issue regarding immunity is that at this point, nobody knows, okay? So that's the bottom line. So nobody knows what is really going on with respect to immunity because we just haven't seen it that long. Now I think that if what we're asking is, if you've had it, can you be reinfected within a short period of time? I think the answer is no. And they've done several studies, especially on rhesus macaques monkeys. And what they found was that when they infected, and these were two different studies, two different groups, okay? When they infected these monkeys, they challenged them, they measured their immune response, then they came back and infected them like 30 days later. They found that none of them got sick. Again, two different groups, two different studies. We share something like 93% genes with these macaque monkeys. And so, but of course, just because we share 93% of our genes does not mean that they are human. Of course, they are not human. So, but I think the idea is that we've not really seen strong evidence at this point. And I think with over 5 million people that have been infected, I think that we probably would have seen some evidence with reinfection. Okay, so that's in the short term. Now, what about in a year from now? I don't know. I would suspect that you may see some variation in the virus. The virus may be transmitting through resource poor parts of the world, and in transmitting through resource poor parts of the world, what you may see is a continuing of viral infections at that point, and what may happen is you may end up with a mutation. And then if those mutations are strong enough or significant enough, that virus can then come back to the US or other resource countries where it has gone through, and then have a new population of people that it could potentially affect. The immune system was established for one virus, maybe not its mutated cousin. But this is all complete speculation. So again, the question was reinfection, Dr. Griggs. So I'm answering the question in two parts. Part one is, in the short term, I don't think reinfection is possible based on some of the data we've seen with the rhesus monkeys. And then I think that is reinfection possible in the long term? We don't know. There may be some resistance, or there may be some variation in the virus that could occur, and as a result of that mutation, there could very likely be a reinfection with the virus. But again, we don't know at this point. Dr. Griggs, do you have any thoughts about that?
No, I was just going to say, we've talked about this before. We don't know how the virus is going to react in humans. There's interspecies reactions and interactions, and then there's intraspecies reactions. We know that viruses, different species of animals have their own viruses. If you've heard of bird flu, swine flu, Animals have their own, and basically what happened with this novel coronavirus is that it jumped from, we know there's a bat, and then there was an intermediary animal to humans, and it takes time to do that. So though it's a good sign in another species, it's not a guarantee. It's just another bright light down the road of a path that we're looking. That's about it.
Super. I'm going to see what happens if I can show. This is the question that we have. How does the virus affect patients who have severe asthma if you've had 2 with 3 months? So I think what they're asking there is if you had 2 outbreaks within 3 months, right?